Growing concern tonight over monkeypox in the United States. More cases are being reported, and the CDC is now saying they appear to come from two different outbreaks. NBC's Stephen Romo explains.
Tonight, new concerns over the monkeypox outbreak. CDC officials have traced two versions of monkeypox now circulating in the U.S.
While they're similar to each other, their genetic analysis shows that they're not linked to each other.
New data from the CDC shows New York with 7 cases, California with 6, and Florida with 4. 2 of the cases in the U.S. were found to be genetically similar to that of a Texas man who traveled to Africa last year. The other known cases resemble the genetic signature of the outbreak of cases found in Europe.
They're both happening simultaneously, which I think reflects the fact that we've let monkeypox be out of control in Africa for an extended period of time.
Doctors explain that these are not variants in the way we think of mutating COVID-19 variants. Instead, these two monkeypox varieties are simply different members of the same family, each marked by symptoms including fever, headache, muscle aches, and exhaustion, along with the development of a distinct rash, often beginning with the face and then spreading to other parts of the body. It can spread when a person comes in contact with an infected animal or human.
That virus likely began to spread through person to person, close contact, possibly intimate or sexual contact.
Those who study viruses say the window is closing on possible intervention. A Yale epidemiologist suggesting LGBTQ organizations are the secret weapon here due to a current prevailing theory that at least some of the current spread started with attendees of LGBTQ plus events in Europe.
The more people that get infected, the harder it becomes logistically to be able to get to all those contacts and vaccinate them in order to stop forward transmission.
Experts say focusing on vaccinations in outbreak hotspots like Africa is the answer.
So it really argues for really putting resources, not just at containing this in Europe, in the United States, and in Canada, but also to be putting efforts into vaccinating people in endemic countries so that we don't have this reservoir to spill into other countries.
The U.S. currently has more than 36,000 doses of the vaccine Jynneos immediately available and has asked the manufacturer, Bavarian Nordic, to send 36,000 more. In the meantime, the CDC recommends using good hand hygiene, especially after contact with infected animals or humans.
People should not be surprised to see the numbers increase for some time, but it's still not something that poses a general risk to the public.